So welcome everyone to our 2024 thank you evening and the return of our Menzies Great Debate. So for those of you who don't know me, my name's Tracy Dixon and I'm the director here at Menzies. And I'd like to begin by acknowledging the traditional owners on the land that we're meeting. Let's see if I can drive this. Oh, Pat. I think I have it on. Pat, you may drive for me, maybe. Aha, maybe. No. I know, we just did the test. Indeed. It will work.
It's good. We've got DJ Nigel here to sort everything out.
Yes.
So.
And it wouldn't be an event without an IT issue. So good to get it out of the way early.
Yeah.
Now we're all...
Do you want to come back to the acknowledgement? Oh, here we go.
It looks like we're in business. Terrific. Thank you. Thanks very much. So I'd like to acknowledge today that we're meeting on Nipaluna, Hobart, in our home, beautiful Lutruwita, Tasmania, and that these are Aboriginal lands, seas and waterways. And I'd like to pay my respects to the traditional owners, the Muwinina people, and I acknowledge that it's a privilege to stand on country and to walk in their footsteps. I'd also like to give my thanks and acknowledgement to the ongoing custodians of these lands, the Palawapakana people, and I recognise their deep connection to our unique island home and their commitment to health and wellbeing in its broadest sense of individuals, of communities and of country. Oh, whoops, now I'm going the wrong way. Bear with me. So I'd like to also extend that welcome and acknowledge the VIPs that we have with us this evening, David O'Byrne, MP, Helen Burnett, MP, and member of our Menzies Advisory Board, Pip Leadham. We thank you for your attendance and for your support of Menzies. So I'm really thrilled to have the doors of Menzies well and truly open again and to have so many people here this evening. In our room tonight, we have long-term donors and supporters, we have volunteers, we have study participants, we have members of our various consumer and community involvement committees, we have Menzies staff and students, we have friends and family, and we have the Tasmanian community. And to all of you, I really want to thank you for coming out tonight and spending your Friday evening with us. So some housekeeping from me. So not only am I director, but I know where the bathrooms are. So if you need the bathroom, they're across the main foyer that you've come past and down the narrow hallway. If we happen to have an alarm, there are many Menzies staff in here. We'll identify ourselves and you can follow us to safety. So our mission at Menzies is to perform internationally significant medical research leading to healthier, longer and better lives for all Tasmanians. We focus our work on the major diseases affecting our community around the themes of brain health, prevention health services and wellbeing, cardiovascular health, cancer and genomics, environmental and respiratory health. And we have two flagship programs of research, one focused on multiple sclerosis and the other on cardiovascular research. Our research at Menzies takes a bench to bedside and disease prevention approach, and it's aimed at improving care and clinical outcomes for the community by translating new knowledge into new treatments, as well as clinical and policy action. Our work is performed in deep collaboration and involvement of members of our community, and your support and contribution to our mission, however it's made, is truly appreciated. So tonight sees the return of our great debate. And for a couple of years there, we had to batten down the hatches due to COVID, and we were unable to hold our debate. But through the power of medical research across our planet, we are able to be together again, and isn't that wonderful? So over the years, the Menzies debate, we have tackled some vexing issues and some wicked problems and tonight is no different. Our debate title is Your Heart, Your Health. It's everybody's business. The debate teams are going to go head to head and dive into the complex intersection of personal responsibility and societal influence in cardiovascular health. To be fully transparent, the debate is intentionally lighthearted, and it does in fact have some of our researchers and colleagues arguing against their life's work and their true beliefs. And so at the conclusion of the debate, our panel will remain up here and be available for a Q&A with the audience. So tonight's debate will be facilitated by the wonderful Bernie Hobbs. Welcome back, Bernie. It's terrific to have you here. So Bernie is best known as a popular judge of ABC TV's The New Inventors and her many years presenting science on ABC radio and TV. She's won awards for the TV show The Experimentals and for her greenhouse website, Planet Slayer. Bernie has a first-class honours degree in biochemistry and microbiology, and before joining the ABC, did a brief stint in medical research and science teaching. And her bio is very clear that she got 0 awards for these activities. When she's not sharing her love of science with people, Bernie appreciates the world around her by birdwatching, cycling and kayaking. So I'm sure she feels right at home here in Tassie. So with no further delay, I'll hand over to Bernie to facilitate tonight's debate. Welcome, everybody.
Thanks, Tracy, and thanks, Tassie. It's so great to be back for the great debate. It is one of the highlights of my emceeing calendar, and it has been greatly missed. The chance to see some leading researchers lie, cheat, and connive their way to a potential victory it's just uplifting, isn't it? It makes you feel like those funding dollars are very well spent. But what I love, especially this evening, was the chance to mix and mingle outside. And I got to speak to people who have lived experience, who are involved in studies, who are donors, who are researchers. And it's really rare. I do a lot of stuff with medical research institutes. It's really rare to see a community so deeply involved in such a two-way relationship as you have here at the Menzies. So go use all. Everyone's a winner tonight, okay? But mainly the team that wins the debate, all right? So Tracy's already given us the title. Let's get that well and truly in our minds again. Your heart, your health, it's everybody's business, which is a little bit freaky in these days of surveillance and, phones listening into everything. The way we'll run it, it's not quite... Who's been to one of these debates before? Yes, I love a return crowd. That's a very good sign. So you may remember it's not exactly like the Year 10 debating competition at school. So we'll have our affirmative team over here. They are arguing that your heart and your health is everybody's business. That's the government, that's the health economists, that's everyone. Over here on the negative team, they'll be arguing your heart, your health, not everybody's business. My business, my heart, my health, my business. So they're the two teams we've got here. The voting is a bit different, and it is my favourite way of voting for a debate of all time. It's not about the absolute scores that each side gets. It's about whether these two highly qualified, yet somehow deeply inept debating sides are able to sway you from what you thought before you heard any of them speak. Before we get to setting that baseline, a beautiful part of all medical research, I want to introduce you to the 6 souls who are going to be trying to penetrate your psyche tonight in a bid to win for themselves a prize that is purely pride. There's no fiscal or any other kind of reward on offer tonight. Okay, so I'll ask the speakers, as I say your name, to just come up and take a seat. First affirmative speaker, leading the team for the case that it is everybody's business, Associate Professor Verity Cleland. Oh. Verity is the leader of the Prevention, Health Services and Wellbeing theme at the Menzies Institute. Her opponent for the negative team, arguing that your health, your heart, your health, it's your business, no one else's. The first negative speaker, Dr. Andrew Black. Yay. Andrew is a staff specialist interventional cardiologist at the Royal Hobart Hospital. Right, Jess, I hate missing the gags. All right. Was there a bit of that? Okay. And it's amazing. I love going off script. I totally applaud that. And it is amazing that Andrew's achieved all of this at the age of 16. Second affirmative speaker, Dr. Michelle Morgan. Michelle works at the Department of Premier and Cabinet as a senior policy analyst and is currently leading the development of Tasmania's first wellbeing framework. Yes. Okay, the second negative speaker. Oh, yeah, no, totally. I feel like, did everyone get 2 rounds of claps? Yeah, okay, good. All right. Just wanting to be as fair as I can. Impartial, that's my job. Second negative speaker, Professor Martin Henscher. It reminds me of our school debates when we'd front up against the boys from St. Pat's. We used to whip their asses, yeah. Martin is leader of the Environmental and Respiratory Health team at the Menzies Institute. Our third affirmative speaker, no stranger to the Menzies or previous debate attendees, Professor Tom Marwick. Tom is a cardiovascular researcher and clinician at the Menzies Institute and at Royal Hobart Hospital. And our final speaker this evening, the third negative speaker, is Professor Shauna Gall. It's nice that they've gone co-ed now. Shauna is the leader of both the cardiovascular health theme and the cardiovascular research flagship at the Menzies Institute. So very much in tune with what's going on tonight. And I have to say she's a bit confident about the outcome of the debate this evening. So let's hear it all again for our 6 spectacular speakers, each one of whom has given quite, well, potentially a significant amount of thought and time to preparing this debate. We'll have to see, actually. But they've each made 3 slides, so that's something. So it's great. We're ready to go. We just need to do one more thing, and that's go through the rules. I am extremely strict on the timing policy because we all love a good show. No one loves anyone who bangs on after the chicken has flown. And by that, I mean at 4 minutes time out of your allotted 5 minutes, the chicken will squeak. That is your indication that you have 1 more minute. Anyone who goes further than that 1 minute, I know that look, Tom. I know that's like, yeah, your mouth is moving, I'm not listening. It's anyone who goes beyond their allotted time will have to be good at the hand-eye coordination because the chicken is coming for you, okay? So that's it. You've got your 5 minutes. You'll get a warning at 4 minutes. We'll start with affirmative. We'll start with Verity. We'll go affirmative, neg, affirmative, neg, affirmative, neg. And then at the end, we'll have our second vote. But first of all, we must have our first vote. Now, I believe if you've been alive and aware for the last 4 years, you've become very familiar with the concept of a QR code. All right. So we are about to have our pre-debate vote. Now, in the past, we used to do this with a fantastic system of pieces of paper that would inevitably get confused, lost, torn the wrong way, or misfilled in. But no, we've gone tech, and as we all know, nothing can ever go wrong with this system. Okay, no, I didn't see anything. Sorry, I didn't see anything. Okay, voting. Look, either everyone votes or no one votes. Have you already done it? Okay, we'll just discount any outliers that have already arrived. We haven't started the count yet. Okay, so I want you to focus your cameras on the QR code. The question is, do you agree that your heart and your health is everybody's business? Do you think it's everybody's business, the community, the government, everybody's business? Or in which case you vote yes. If you think it's not anyone else's business, it's purely your business, it's your heart, it's your health, you vote no, I disagree. So are we all okay with that? Have we got our QR codes? Does anyone need a phone to vote with? You've got a dumb phone. I love that. Do you want me to vote on your behalf? No? It's going to be like the American election. Okay. Yeah, no. Yes, we have had a warning that it could be something like next week's election on Tuesday, but no, there won't be any of that. No. Okay, so one phone, one vote. If you've got a dumb phone and you want to have a vote, we can just do that now. Does anyone not have a phone and wants to have a vote? Okay. We'll just add these numbers in. If you want to vote yes, you agree, would you put your hand up and we'll have a count now? 1, 2, this is just people who don't have a phone to vote with. 3, 4, 5. By geez, you better not have phones and be doubling up. Okay, hands up, hands up. I see you with a phone in your hand and putting your hand up. Honestly, we'll never get to the debate. All right, quick sticks. If you've got no phone and your only option is a hands up vote, put your hand up for yes, I agree. 1, 2, 3, 4, 5, 6, 7. And you're on Tom's team. Okay. 8. Okay. That's everyone. We've got 8 for yes. If you have no smartphone and you want to vote no before hearing the argument, 1, 2, 3, 4, 5, 6, 7, 8, 9. It's quite an indication there. Okay. All right. Are we ready? We've got the results. Good Lord. Okay. We're starting from a baseline of yes, I agree. It's everybody's business, 65%. Now, remember, it's not either side's job to get the biggest difference, like to be out front. Just because yes is out front there doesn't mean they've won. What you have to do now is try and sway the audience's opinion. So if the audience is still yes ahead at the end of the night, then the affirmative team has won. If the audience loses a bit of that 65%, even if they go down to 64.5%, the negative team has won. So that's what we're looking for. That's what we're looking for. It's a changing of minds. No, you can change minds. They be added in. 8 and 9. Are we ready? Let's give it up for first speaker for the affirmative team, Associate Professor Verity Claylock.
Thanks, Bernie. So great to be here. So great to see everyone here tonight. Thank you, Tom and Michelle, for being on my team. Sorry to you guys. Everything I know about debating, I've learnt from my 11-year-old. So the things are rhetorical questions, eye contact with the crowd, emotive language, and hand movements. So here's Nan's in the audience tonight. Hi, Leanne. Can you let Patrick know how I go? Thank you. All right. So your heart, your health, it's everyone's business. That's our topic tonight. And we interpret everyone's business to mean individuals, governments, the community sector and the private sector working together to support health and wellbeing. We're approaching this from a perspective of prevention. Prevention, going the right way. Prevention exists on a spectrum that you can see on the slide. Primordial prevention takes a broad perspective and focuses on the wider environmental and social determinants of health. So, for example, the provision of safe cycleways to enable cycling. So I'll speak a bit more about this in a minute. Primary prevention focuses on reducing risk factors to prevent disease before it arises, for example, through a walking school bus initiative. Michelle's going to talk a little bit more about this tonight. Secondary prevention focuses on early detection and management of risk factors and diseases to reduce their impact. For example, referral to a community-based exercise program when you've been identified as having high blood pressure. And tertiary prevention focuses on reducing harms in people who already have disease or conditions. For example, a cardiac rehab program after you've had a heart attack. And my colleague Tom, who's a cardiologist, is very well positioned to speak to this tonight. So by the end of tonight's debate, I am utterly certain that you'll be convinced by our team's argument that your health is everybody's business. Right, so we can tell people all they like to be active, to eat well, to not smoke, but there's really strong scientific evidence base that this alone, without the supportive systems in place, is extremely unlikely to result in behaviour change. Primordial prevention is about creating environments that promote health by encouraging healthy behaviours to stop people getting sick in the first place. It makes sense, right? Rhetorical question. It's also about the social determinants of health. Now, and these are things like education, employment, housing, and public transport. Housing, education, employment, public transport. So I wouldn't be a real epidemiologist if I didn't show a graph tonight. So there you go. What this big figure shows us is that people with the lowest levels of education in this first bar have the highest rates of death from cardiovascular disease and much higher compared to people with higher levels of education. And this pattern, this social gradient is seen in, no matter which way you look at this, income, home ownership, employment, area level, socioeconomic status. So no matter which way you dice it, really clear social gradient in health. So governments have a really crucial role in shaping those social determinants, making it everybody's responsibility. There have been some remarkable examples of health successes arising from health being everyone's business. Water fluoridation. So Australians born after 1970 have half the rate of tooth decay than their parents' generation. Reductions in neural tube defects, things like spina bifida, have resulted from mandatory fortification of bread with folic acid. Road safety. We have speed limits. We're not allowed to drink drive and we wear seatbelts, and that reduces the risk of dying in a car crash. Immunisation, breast and bowel cancer screening, tobacco control. Can you imagine if the government did nothing? Went the wrong way again. We'd be living in some sort of Mad Max-like world where chaos ruled and health really didn't get a look in. So finally, our opponents will tell you tonight that your health is your business and it's no one else's. There should be a free market. People should be free to do as they want. By agreeing with these unfathomable, big word, notions, we're accepting that it's okay for people to drink drive while not wearing seatbelts and speeding. It's okay to sell alcohol and cigarettes to children because it's their choice. And telling you not to get sick, but if you get sick, just sort it out yourself. But maybe if you can afford it, we'll look after you. Free market is good for business and the economy, but by doing that, we gravely or even fatally jeopardise the health of our community, putting profits before people. So when the voting happens tonight, I call on you, the good, sensible, caring citizens of Tasmania, to support the Affirmative team's argument.
Yeah, I think more applause for being so spot on time. Verity, obviously we can't drink drive while not wearing a seatbelt and whatever those other things are, because it's not Queensland in the 70s anymore. So, and I do just have to apologise. You know, my job's not that complicated. One of the things I was meant to do was read out Verity's bio. And what we're going to do now, because it's being filmed and because she went to such a lot of trouble to write a really long and detailed bio, is we're going to pretend we haven't heard from Verity and then we'll edit this in later. Beautiful. It's totally seamless. I promise for everyone else it'll go like tickety-boo. All right. Verity, blah, blah, associate professor, theme leader. I said all that earlier. Verity's an epidemiologist, but the type who focuses on preventing non-infectious diseases like heart disease and diabetes, not infectious diseases like COVID. Is this working, like introducing you after you've...
Not really. Some of my gags relied on
Oh, so I know, I feel really bad about that, but your gags were gold, like the hand movement, the emotive. You really played it very well. You're very involved in government stuff. Lives with her husband, two boisterous primary school-aged boys, two noisy guinea pigs that have lived a lot longer than expected. I think that's what happens when you're in a household with an epidemiologist who's focused on prevention. And one widowed goldfish that has turned white. I feel her pain. Honestly, we're all getting there. On weekends, she alternates between being a soccer goalie in the backyard and supervising kitchen experiments typically involving bicarb soda, vinegar, food dye, marshmallows, and lemon juice. Woman after my own heart. If you can't blow it up with cleaning products, what is the point? Okay, please join me in welcoming Associate Professor Verity Cleland. That is going to be so seamless in the edit. Yeah, it's beautiful. Nigel's working on it right now. Great. Okay. We've heard our first affirmative argument. Now let's hear from the negative. Verity gave us a clear idea of what she thinks they're going to be arguing, but let's hear it from the very horsey mouths themselves. First, I don't even know what that means. So, yeah, I don't know. It's not good. Yeah, I don't know. First negative speaker, Dr. Andrew Black, is a staff specialist interventional cardiologist at the Royal Hobart and clinical lead for the Tasmanian STEMI network. He didn't bother saying what that is, so I'll leave it up to you. He's a member of the steering committees of the Victorian and National Cardiac Outcomes Registries and holds positions with the Royal Australian College of Physicians as a college examiner and member of the Cardiology Advanced Training Committee. Andrew is an adjunct researcher with the Menzies Institute and is completing a PhD through the University of Tasmania with a focus on improving systems of care and embedding preventive cardiology within tertiary care settings. Andrew owns no guinea pigs. I mean, I'm assuming, like, you're pretty busy, so yeah, just rabbits. Give it up, please, for our first negative speaker, Dr. Andrew Black.
Okay, thanks, Bernie. I'll get going because I suspect the chicken starts the timer straight away. So, ladies and gentlemen, your heart health is not, of course, everyone's business. Whilst it can be influenced by external factors, it is intrinsically linked to decisions that you make as an individual. So government intervention and healthcare policy can inform and empower, but at the end of the day, it's the individual's responsibility to act. What are these slides up to? Here we go. So 80% of early heart attacks are preventable and can be attributed to a relatively small number of modifiable risk factors. So if heart health is everyone's responsibility, surely we would all consume a healthy diet, exercise regularly, treat our blood pressure and cholesterol, and tobacco companies would pivot to growing daisies. Now, we'll hear no doubt about how public health has contributed to a good reduction in smoking rates over time. But in reality, the drop is pretty modest, from 24% down to 18% on the most recent stats. And that's despite substantial efforts from various governments and NGOs over the past 40 years. This isn't really a stunning success and in fact provides solid evidence of the power of the individual choice to overcome the collective efforts of the everybody. So we all make choices that undermine our health at times. Who here had a glass of wine or 4 before the debate started? Who has ever smoked a cigarette or snorted cocaine off a stripper's back? Put your hand up, Tom. Come on. Now, we know that all these things, Tom, aren't good for our health, but yet at times we disregard health advice because sometimes things are just more fun than managing cardiovascular risk. And people are entitled to make poor decisions. I've seen heart attack patients totter off to McDonald's with their IV lines running because they felt like a little treat. We put new pacemakers in some patients who twist them around and around and around until the leads come out and they collapse. But we know that poor decision-making isn't limited to cardiovascular disease. Consider the many people who enjoy inserting objects in their rectums only to have to come to the hospital to have them retrieved. These are all, you didn't think this was going this way. These are all real examples. That is a button-up pumpkin, and that is a mannequin's arm on the other side. And in fact, this has become such a problem that the World Health Organization is looking at declaring a global public health emergency. So while we can guide patients, we can't control the choices they make. But what happens when the stakes are high, like when someone has a heart attack? Surely that's everyone's job to fix that, right? Did you see what I did there? Yeah. Oh, sorry, hands, but I'm holding cards and it's too hard. So from the moment the 000 call is made, the health system kicks into gear and the patient is rapidly transported to the best facility to receive urgent life-saving care. Delays are kept to an absolute minimum. And so the system over here represents the everyone in our debate. But notice the patient delay on our left. It looks pretty small and innocuous, but I can tell you it's often much longer than the system delays. As patients have chest pain, they might wonder about looking on YouTube or post on Facebook to see what to do, have some Fireball whiskey and some Mylanta, and then eventually call an ambulance. And then even after successful treatment, some people will undermine their care further by declining to take the critical medications that are prescribed like aspirin and statins simply because, well, they just don't really want to. So individual choices definitely sit at the core of health outcomes. So if the decision to implement positive health changes depends on the individual, are we doomed to fail? Absolutely not. We recently ran a clinical trial at the Royal seeking to embed positive health outcomes or positive risk factor modification amongst a group of patients attending the Rapid Access Chest Pain Clinic. Thank you, I was waiting for that. And we then randomly allocated patients to an enhanced risk management strategy and compared their outcomes to a usual care approach. So with the intervention arm, we talked to the patients about their heart attack risk and then helped them put in place strategies to modify that risk over time. We didn't have any ongoing review. We didn't put cameras in their house or ban them from eating KFC. But 4 years later, these patients achieved significant improvements in their cardiovascular risk. Blood pressure lowered, cholesterol lowered, 1 in 3 smokers quit, and physical activity levels improved. The intervention worked because we recognised the critical role of the individual in managing their cardiovascular risk. So individual choices are the true determinants of heart health, not societal or governmental actions. So your heart, your health. Ultimately, it really is your responsibility. Mr. Chicken.
Smooth and coming in 9 seconds under the clock. I mean, if I was voting, but no, it's not about how much time you save. So interesting. All right. So we've had Verity pitching the messaging, the different approaches to prevention, and prevention really is the key. And then Andrew's come back with a really tailored one-on-one individual approach with the right health professionals can really have great outcomes, apparently at very minimal cost too. I imagine. Absolutely free. Beautiful stuff. All right, let's hear. We're ready for some more affirmative speakers? Yes, okay. Our second affirmative speaker, Dr. Michelle Morgan. So Michelle, throughout her career, has led diverse public health initiatives using her expertise in policy development, systems thinking, and place-based approaches. Her work emphasises the importance of preventive health, collaboration, and community empowerment. Michelle completed her PhD at the University of Tasmania, and her research explored the factors that shape local governments' roles in health and wellbeing and identified opportunities to enhance those roles from a state government perspective. Her research has been influential in real-world practices, shaping local and state-level policy decisions. Michelle's work is motivated by a commitment to create positive, meaningful, and lasting change to improve health and wellbeing for all. Her work bridges the gap between research and practice, ensuring that policy decisions are informed by the evidence while being responsive to the complexities of real-world challenges. Michelle continues to strive for a holistic, system-wide approach to public health in Tasmania. So, well, you wrote it. I can't help it. It goes on for a day and a half. Like I wasn't given the option to edit. Can I edit on the fly? No. Okay, that would be unfair. Okay, Michelle. You'll hear that again in 4 minutes. Woo!
Thanks, Bernie, and sorry everyone for that long bio. It really didn't feel that long on. Yeah. Well, thank you all for having me here today. And as we've heard from the opposition, they'll have you believe that heart health is an individual's responsibility. I'm surprised that they haven't even referred to it, government intervention on heart health, as the nanny state, implying that the government is acting like a nanny, that nans are overprotective or excessively involved in our personal choices and lives. Now, I don't know about you, but I've got an awesome nan. And I'm sure there are plenty of awesome nans in the audience with us today. Can I see a raise of hands of all the awesome nans here? I'm sure that you are all fantastic nans as well. Now, nans know best, whether it's about getting you to eat your veggies or ensuring that you rug up in winter. And just like nans, the government is here to protect you, support you, and help you live a long, healthy life, even if it means giving you a gentle nudge every now and then. Let's face it, many things that affect heart health are beyond what we can control alone, which is why it's everybody's responsibility. And all levels of government have a big role to play. And here are some of the ways they're helping out. First, think about our need for safe places and spaces to be active: walkable streets, bike lanes, sports fields, playgrounds, nature reserves. Just like Nan insists you get out for some fresh air, the government makes sure that we have places to do it safely. And it's not like we could all just start building our own bike lanes or playgrounds. These community spaces need public funding and coordinated planning to keep them safe and accessible. That's where the government steps in, giving us those places to stay active and enjoy life. The government also regulates health risks associated with things like alcohol, food, and tobacco. In Australia, the government has some of the toughest tobacco regulations in the world, from plain packaging to high taxes and restrictions on where people can smoke. Why? Because reducing smoking rates protects heart health. And as can be seen on this slide, it's quite clear that over time that these interventions have been effective at reducing smoking rates. The same goes for alcohol. To curb excessive drinking, which is linked to heart disease, the government sets minimum pricing on alcohol and controls advertising, especially to our younger people. And for food, Australia's health star rating system and requirement for nutrition labelling are examples that help us make informed choices. Population-wide interventions like these are more effective and cost-efficient than treating heart disease after it develops. They work on a level that individual actions alone simply can't achieve. I mean, imagine trying to negotiate with big tobacco or the alcohol industry on your own, even with the help of Nan. Good luck with that. Finally, the government provides Australians with access to essential cardiovascular health services and medications. Through Medicare, the federal government subsidises medical consultations, diagnostic tests like cholesterol screenings, and heart-related treatments, ensuring that everyone can access critical heart health services. Programs like these allow for early detection and management of cardiovascular conditions, reducing hospital admissions and long-term health costs. And the Pharmaceutical Benefits Scheme helps make medications for heart disease and related conditions like hypertension and diabetes more affordable. So just like Nan keeps cough syrup in the cupboard for when you need it, the government makes sure that essential healthcare is there when we need it without breaking the bank. These examples show how that the government isn't being intrusive or overprotective. They're making sure that everyone has access to the resources and the support needed that would be tough to secure on an individual basis. All levels of government have a big role to play in keeping our hearts healthy. Yes, they use taxpayer dollars for these initiatives, but without these preventive efforts, the impact of heart disease would cost us all much more, both financially and in lives lost. So when you hear someone scoffing about the nanny state, remember that nans know best.
Well, okay, two things there. That was a pretty random cluck of the chicken because I couldn't find where I'd put my phone. So I was kind of half counting and half trying to read it off my watch there, but it felt like a very nice 5 minutes. So well done you, Michelle. The other thing that really struck me was on that graph, it looked to me like smoking rates had in fact gone from 26% down to about 13% in 2014. Okay, right. So I was just assuming that you were using 1998 data to fit your argument. You checked it this morning. Okay, I'll leave that to the experts. All right, yeah, no, we're getting a very, very clear signal from the cardiologist. They stick together that lot, don't they? Yeah. Okay, all right, how are we feeling so far? It's pretty tight, I've got to say. I don't know which way I would be voting. Lucky I don't have a say. Ready to come to the microphone, our second speaker for the negative team, Professor Martin Henscher. Martin, as well as being Martin Henscher, is also Henry Baldwin in terms of professorial research fellowships in health system sustainability at the Menzies Institute for Medical Research at the University of Tasmania. He's got degrees from a little place called Oxford, the London School of Economics and Political Science, and a PhD from the Menzies Institute. He has over 30 years global experience in health economics, planning and financing, gained as a civil servant and a researcher in the UK, Central Asia, South Africa and Australia. Now, if anyone else feels like maybe they left their bio a bit long, just feel free to stop me at any time. Martin's research focuses on integrating the economic, environmental and societal dimensions of improving the sustainability of healthcare systems. His work integrates health economics with ecological economics to answer questions including climate change mitigation and adaptation for healthcare systems, the future of healthcare in a post-growth economy, and overconsumption and diminishing marginal returns in healthcare. He's co-lead of the Lancet Commission on Sustainable Healthcare Working Group 4 on Health System Transformation and a member of the World Health Organization's Technical Advisory Group on the Economics of Environment, Climate and Health. And with that, he said, no, Bernie, that's enough. Stop there. Roll on the long bios. I'm a fan. The next page is the third speaker. So please give it up for Professor Martin Henscher.
They did say 200 words. Everybody's business. I think I remember a rhyme about that. Everybody, somebody, anybody, nobody. If you ask an economist to talk about individual responsibility, you're going to see Adam Smith, the man, the moral philosopher, the father of political economy, and the father of the idea of the invisible hand of the market. Smith argued, it's not from the benevolence of the butcher, the brewer, or the baker that we expect our dinner, but from their regard to their own interest. And that has guided 2.5 centuries of liberal philosophy that has made this country the country it is today, where we believe that free individuals taking responsibility for their own interests through free markets will deliver the greatest public good. But our dinner no longer comes from the butcher, the brewer, or mine from the brewer sometimes, or the baker. And unlike Smith, we no longer meet the people who provision us at church or at the pub or at the coffee shop, where they would have to look us in the eye if they had knowingly caused us harm. Instead, the modern butchers and the bakers sit in boardrooms far away from us at the end of global supply chains. Cargill, Nestle, Coca-Cola, Mondelez, making ultra-processed foods. Philip Morris, tobacco, Shell, Woodside, BHP, fossil fuels, and air pollution. All their products directly drive heart disease and a myriad of other harms. Now, there were corporations in Smith's day, but those corporations didn't deliver Smith's dinner then. They actually were the engines of colonialism and imperial extraction. Think of the East India Company. At home, think of the Van Diemen's Land Company that massacred 43 Aboriginal people at Cape Grim for stealing sheep. And since those days, and that inauspicious start, we've given those corporations what we call corporate personhood. We've made them equivalent to humans. And their directors and their owners have been granted limited liability, so they face little or no consequence for any actions and harm that they may cause, including to your heart. And this toxic combination of corporate personhood and limited liability has turned these corporations into what Joel Bakan calls institutional psychopaths, amoral, pseudo-human entities accountable only to shareholders, and whose shareholders themselves face no consequences for the damages of what they do. And indeed, these corporations now attract human psychopaths to be their leaders. We know that from psychological studies. So there's actually only one way that we are going to tackle this problem, and it is returning to individual responsibility. But not just your individual responsibility for the health of your heart. We actually need to end this corporate personhood, and we need to end the existence of limited liability in business so that the chief executives and the directors and the shareholders of all these corporations are themselves personally on the line for all the harms that they may cause. I'll take another 15 seconds, thank you. So each of us as citizens must insist that individual responsibility is actually taken by all those who harm the health of others. And only that way can we empower all of us to become fully responsible for our own health. And only then can Smith's invisible hand work its magic once more, and the corrupted heart of the market be returned to health. Thank you.
Let me just say that was in no way an endorsement of either team, but as the product of working class convent schooling, every time I hear anyone say something that basically says, let's eat the rich, I just have to burst into a round of applause. It's some kind of deep-seated post-traumatic thing. Anyway, so completely bipartisan here. Absolutely nothing intended to sway anyone's vote one way or another. Someone who is going to attempt to sway votes more to, pump up, increase the lead of the affirmative team is not a professional psychopath, even though he has been the director of many institutes. That's different, isn't it, from being the CEO of a giant corporation? Quite different. Not different? Little bit different. Tracy concurs. Very, very different. All right, our final speaker for the affirmative team, Professor Tom Marwick, proud member of the hitherto unknown Pale Male and Stale tribe of the privileged nation. He completed training in medicine and cardiology in Australia before undertaking an imaging fellowship at Cleveland Clinic, a PhD at the University of Louvain, Belgium, and a master's in public health at Harvard. I'm not sure why he had to keep leaving countries. time will tell. He was previously head of cardiovascular imaging at the Cleveland Clinic, director of the Menzies, as well as the Baker Institute in Melbourne, and has now returned to his own research and clinical work at the Menzies and the Royal Hobart Hospital. He has tried unsuccessfully, by definition, to repay the benefit of his privileged nation status by teaching and training innumerable health professionals and about 50 PhD students, developing new knowledge in over 1,000 scientific papers and books, and working exclusively in the public hospital system. He tries to listen to their ABC as much as possible, but not Bernie Hobbs' program. Well, joke's on you, Tom, because my program got axed. Nah. Tom has experience of living and working in the UK, Europe, and the USA, as well as Australia, and is well placed to provide a perspective of how cardiovascular health is everybody's business. Professor Tom Marwick.
Bernie, ladies and gentlemen, we've heard a lot from the Mad Max team here regarding personal responsibility. Actually, we heard a few other things from them. Do you see those Trumpian changes of the numbers there that you were presented with? And then economics, the dismal science. Who would have called it that, for heaven's sake? But I just want to draw your attention to the fact that the people that we are debating tonight, Shauna Thatcher, Andrew Trump, and Martin Mill, are quite different from their personal responsibility namesakes, Margaret Thatcher, Donald Trump, and John Stuart Mill. In fact, their written opinions clearly support our position that cardiovascular health depends on the community. Shauna, higher tobacco retail density, controlled by the government, is consistently associated with cigarette smoking. Mechanisms to control retail density should be considered as part of tobacco control strategies. Well, that's not personal, is it? Andrew Trump. Both patients and doctors estimate cardiovascular risk imprecisely, informing patients about risk scores, which are made by national bodies. Oh, there's nothing personal about that. Can significantly influence their cardiovascular risk profiles. And Martin, I love this one. Out-of-pocket healthcare costs are undermining the goal of universal care. Despite the impact of out-of-pocket costs, user fees and out-of-pocket costs are not effectively regulated. Not by personal responsibility, but what's missing here is the government. Our opponents clearly agree with us that cardiovascular health is everybody's business. So far, we have spoken about cardiovascular health and prevention, but I'd like to take a few minutes to talk about the community's role in the management of overt cardiovascular disease. Now, we have expectations of patients with cardiovascular disease. We want them to take their medication. We want them to pay for their GP or specialist visits, pathology or imaging. We want them to attend for their visits and therefore get themselves there, have money for parking and petrol. We expect them to adhere to a healthy diet, although in fact a happy meal is a lot less expensive than a healthy meal. And of course, exercise and reduce sedentariness and stop smoking. Now, you would be forgiven for believing that failures of cardiovascular management are due to lack of patient responsibility. You'd be in good company because the National Heart Foundation said that themselves in their Heartless Words campaign a few years ago. Surprisingly, that didn't go down too well, and that campaign was axed. Now, the assumption of the Mad Max team and their supporters is that people have got the resources to do what we expect them to do. And this slide is to show you that, in fact, they don't. There is a social gradient of disease. And you see here, these are Canadian data. We have exactly the same from Australia. The poorer that you are, the more likely that you are to have cardiovascular disease, and especially so in Aboriginal peoples. People can want to do the right thing, but without assistance from the rest of the community, they physically cannot. And so I want to move on to a final slide, and this is a patient of mine at the hospital. And the reason I'm talking about this patient is that his survival is because we do perceive health as being everyone's responsibility. He's actually alive because of that. This is a 56-year-old man. He is disabled from a farm accident. He has got known coronary disease, and he's refused to take his medications. He's now got recurrent chest pain. There's a lot of discussion about whether we should do another stent procedure because we're worried about his adherence to tablets. There's a lot of concern that he's going to die prematurely, but eventually, it may have been Andrew, did the stent procedure, and we decided that we would have to do other things to try and ensure that he adhered. So he comes to my clinic on a regular basis. We make sure that he's got ongoing medical therapy. He has taken that medical therapy. His diabetes is under control. He's had no further problems with his heart. He even models his medication adherence for his grandson, who also has to take medicines for ADHD. Now, my point here is that no amount of exhortation about personal responsibility could have enabled this patient to get to where he is now. It's because we, the government hospital, have produced a safety net for him. So it is the American electoral year, and some of you may remember Spiro Agnew, the niggling nabobs of negativism, tell you that government responsibility is a moral hazard or costs too much. Taking care of disadvantaged people is what we do. Thanks, Amy.
Andrew, I'm never going to be able to look at you again after seeing that transformed version of your visage. It is, it is scary. And obviously, you know, very busy life being a cardiologist and researcher, just had time to spend hours on Photoshop, Canva, and trawling. I don't think it's fair to quote back at people what they said in the published literature. I mean, if we start going down that path, who knows where we might end up. Look, I mean, there's been flagrant disregard for the light-hearted spirit of the debate here this evening. Let's see if Shauna Gall can't get us back on the crooked and wide path instead of the straight and narrow. Professor Shauna Gall is a reformed laboratory-based physiology researcher that found the light of epidemiology during her PhD. She was sent to Hobart in 2006 for the term of her natural life for the crime of having completed her PhD at the University of Melbourne. During her sentence, it actually said that here, during her sentence carried out here at the Menzies, she has made the most of her time and contributed greatly to the world of cardiovascular research, published over 150 manuscripts, secured over $17 million in research funding, and supported over 10 other members of the colony to achieve their PhDs in cardiovascular research. Professor Gall holds a number of positions with important government bodies and community organisations like the Tasmanian Government, the Australian Institute of Health and Welfare, Australian and New Zealand Stroke Organisation, and Stroke Foundation. Or does she? That was a rhetorical question, so I was doing that. It's very influential. Yeah. Shauna would like to emphasise that this should not be seen as an endorsement of the role of government and community organisations in heart health. Rather, this is an elaborate, strategic and long-standing act of resistance from within, so she can continue to promote the important role of the individual in achieving heart health. Nice, Shauna. Final speaker, Shauna.
Thank you. Thank you. Okay, so I have the pleasure of closing the debate tonight and undoubtedly convincing you that when it comes to heart health, it really is individuals that are key. So my colleagues on the affirmative team here have somewhat eloquently made their case about the role of systems, including governments and councils and other bodies in our health. However, Ronald Reagan really summed up the key issues with relying on government when he said, "The 9 most terrifying words in the English language are, I'm from the government and I'm here to help."
I needn't remind everyone here in this room that governments, companies, and systems are bad at addressing the key issues affecting our population. Now, I could stand here and tell you about the multitude of failures in these systems that have led to the current state of affairs with heart health. And I could tell you about the very poor correlation between spending on healthcare and health outcomes, but I won't. Rather, my key argument is that the issue with saying that heart health is everybody's responsibility is that we risk it becoming no one's responsibility. And we must acknowledge the role that every individual plays in heart health, particularly within these ineffective and inefficient systems. Now, there are countless national and state action plans and strategies targeting heart health and its risk factors. And these have been developed by very well-meaning people, including myself and members of this team. They take many months and years and countless dollars. But what we must understand is that to enact these plans, to make change and to translate evidence into practice to improve heart health, we really need individuals. Governments, committees, working groups, task forces can write all of the plans they like about how to improve our heart health. But anyone here that has been involved in a group project knows that to put these into place, we need individuals. My team member here, Andrew Black, is a living and breathing example of how an individual can make a difference to heart health at a big scale. He's already told us about his work at the Royal Hobart Hospital and the Rapid Access Chest Pain Clinic and the importance that this had for people. So the existence of this clinic demonstrates why individuals are so important for heart health. It was through his development, implementation, and evaluation of this new way of managing patients that we got evidence that the clinic worked. And as he told us previously, it had many important outcomes, reducing those people's risks of cardiovascular disease and resulting in less cardiovascular events. So this change was the result of the actions of an individual. Of course, it wasn't just Dr. Black. He was supported by other people, but it took one person to see the problem, one individual to think of a solution, and one individual to push for change. The affirmative team have told us about the importance of legislation and policy and improves heart health. And as pointed out kindly by Tom, I myself have been involved in these tobacco control strategies. So I wholeheartedly agree with this stance. But what I would like to remind you of, that getting legislation enshrined in law is in fact down to individuals. Our parliamentary system requires that members of the upper and lower house vote on legislation. Members of parliament are individuals. While they may eventually vote on party lines, they must agree together as individuals on what the party line will be. So we cannot get changes in legislation to improve heart health without the action of these individuals. I have seen very worthy evidence-based legislation aimed to protect young people from smoking sink because we as public health advocates and we being individuals could not convince enough members of parliament to vote for this legislative change. So it is clear that when we think of collective responsibility like governments, that ultimately we rely on individuals to make the right choices for our heart health. So let's not risk making heart health no one's responsibility. And let's think about the fact that while there is no I in team, there is an I in action. And so in closing, I would like you to think of your role in not only your own heart health, but the role that you are playing in the heart health of your family, your friends, and your community. Thank you.
Spirit of Tasmania. I don't get it, but I laughed along. I look forward to being enlightened extensively. Very good hit there. Okay, we have heard from both sides. We have heard well thought through, passionate, rhetorical and hand-gestured arguments from across the entire range here. And now it's time for you to give your final vote. Oh, and that's your speaking time. Well done, you not, using up too much at the end there. Well done. So what I want you to do now is just take a moment to take that QR code and think about what your feeling is now. Do you now agree or do you now disagree? Irrelevant which way you voted the first time, do you agree that your heart, your health is everybody's business? It's not just yours. It takes the community, it takes the government, it takes you as well. Or do you agree? Do you disagree with that? Okay, if you agree, you were big fans of what was happening over here. If you disagree, you were swayed by what was happening over here. That's all you need to remember. Agree, disagree. Keep it simple. Who needs more time for voting? Bit more time for voting. We'll leave it up so you can remember you can only vote the ones, and we're going to do that hand raising acoustic version of voting. If you don't have a smartphone and you need to vote, can I have a hand raise for you agree that it's everybody's business? We've got 1, 2, 3, 4, 5, 6, 7, 8. Oh, you made a decision. That's good. That's good. Because you were on the fence before. That's excellent. All right. So we've got 8 for agree, for if you disagree and don't have a smartphone and can't vote with the QR code. 1, 2, 3, 4, 5, 6, 7, 8, 9. Jeez Louise. 10, 11, 12, 13, 14, 15 disagrees. Hang on a minute. You're right. Hang on. We should still have a total of 17 voting. Hang on a minute. All right, plus there's Nibs down the front who couldn't vote last time. So 18 max. Geez, I don't know what to do in this situation. We'll have to see if it's a clear and compelling case from there. All right, yeah, no, we'll go back to the paper method because that was so successful and uncontroversial. All right, now it's your opportunity to ask questions of everyone. The current director of the Menzies, Tracy's Dixon, all of yous. There are multiple Tracys in that one director. Are you going to be answering questions as well? Okay. Do you want to be? Oh, okay. All right. Well, that seems like you're highly qualified for that. All right. So what we're going to do, this is your chance to pick up on anything that was asked during the debate or to ask questions. Please, no medical consultations. They're out of hours now. So please, if you've got a question for any of our experts here on the panel, we have got microphones. Well, you've got a question right here. Who's it for?
I'll address it to Tom.
Oh, no, I'll be holding the microphone. I know what crowds like this get like. All right. Yes, your question.
I've got the all right, fine. The tax, tobacco tax conundrum. You had bipartisan support federally. Now the opposition is saying, look, organised crime have got in because the high taxation rate of tobacco, they're undercutting it. So you're getting an increase in consumption. And then you've got the criminal element coming in. Do we bring back the tax or as far as effectively, or do we still stand with the public forum of saying high taxation to dissuade people or discontinue tobacco, please?
Well, that's a really good question, and I'm probably not the most expert in this. I think Shauna probably is, but I do know from my knowledge of epidemiology that if you make something more expensive, people are less likely to use it. And so I think that the short answer to your question is that multiple strategies are needed. But I personally think that high taxation is part of the solution, Shauna.
And now what about the informed answer to the question?
Well, I think Tom is, yes, correct. The evidence actually shows that rapidly increasing the tax when people don't know it's coming is most effective. So that's what the government should be doing, but they plan to do them and then people know. So it's possibly less effective. I think that, yes, it's known to be effective, but you have to have a lot of other things around it to support that it's effective. And in particular, what's being implemented around the country is having licensing systems for who sells tobacco. We have one in Tasmania and have had for many decades, and that means we know who sells tobacco, so then we know who's not supposed to be selling tobacco. So they have not been implemented in every state and territory. So once they are in place, we should have a better control on what's happening, and law enforcement can take control of the rest.
Great. Thanks, Shauna. That's an excellent question. Very topical. Do we have any other questions? They don't have to be that good. Like, here we go. An also ran question. Pat, Tracy, I feel you're being underutilised. Just take a moment. Just try and have some like really directorial thoughts about what's going on at the moment. Yes, your question.
Thanks to the panel, first of all. You made a few references to governmental interventions, fluoride in the water. Most of us have benefited from that, and also probably most of us in this room are vaccinated against COVID.
Geez, I hope so.
So my question is, perhaps you can answer why my 5G is not very fast right now.
Right. Why the 5G? Is it the invisible hand of Wi-Fi, Martin? Why the 5G is not very fast right now?
I say that in jest, obviously. Hopefully not to make fun of too many people in the room. But I guess my general question is, how do we address these public health conundrums when we have large segments of the population who are buying into these cultural trends that are kind of anti-science? We have individual rights behind that. This kind of mantra that do your own research, which means read something on the internet. They're not doing double-blind studies, obviously themselves. Maybe you guys can talk to that a little bit. How do we mesh that government intervention with the individual that is really not acting in its own interest quite often, or actively against itself?
Verity.
I don't really have a great answer to that.
Excellent start.
Aside from, the thing that pops into my head is that less than 2% of the health budget goes towards prevention, and included in that would be your public health messaging and communication strategies. So I feel like we've got a fair way to go. We could be doing a lot better in that space, because I guess health communication and media campaigns would fall into that bucket of money, and we really have very limited resources to do that. And you're fighting against big tobacco and other organisation. You're fighting against our friend Donald, who likes to spread misinformation. I think it's really challenging. I think there's been a seminar recently on misinformation. So we're educating ourselves, trying to keep up as public health practitioners, but it's a really challenging one. Did anyone else have anything more insightful to say there?
I wasn't putting my hand up because it's more insightful, just because I had something to say. No, I think so. That's a fantastic question, and it's the kind of the question of the age, really, isn't it? And I think it's also this is a cultural phenomenon which has been brewing for quite a long time, that has then been accelerated by various factors. It's clearly not something that there can be an overnight solution to. I think from the government side, in this country, I think we are still better placed than many countries around the world, but restoring public trust in all of our institutions, not just our politics, all of our government institutions, is enormously significant. And we've seen even the trouble that things like the National Anti-Corruption Commission has already sort of got itself into, just shows how vital it is that our institutions must be open, transparent, and completely accountable to even let us start on this problem. And then we really face fundamental questions about the limits of free speech. What does it mean to actually have a free media, really, particularly when that media is owned by huge corporate interests, when it's all enmeshed in political donations, et cetera, et cetera. So it's I've not got any answers, but I do think we are further from the precipice here than many countries, and we need to use that time urgently to make sure we don't go over too.
Yep, Shauna.
Yeah, and I guess what I would like to add, that I think events like this, where we bring the community into the institution, and we have this was in fun tonight, but obviously we're serious researchers. And Bernie mentioned in our opening that we work a lot with the community and people with lived experience of various diseases in designing the research we do. They can see how the research works. They're a part of the whole process. And I think that increases the knowledge of the community about how we work and how important it is for us to do that in an ethical way and in a way that's sound. And I think if more people understand the scientific process, then they'll have faith in the evidence that comes out.
Here's hoping. I think, one more quick question just there, Pat.
Hello. Look, this is terrific. We've got the collaboration with researchers, medical care at the hospital, public health. How do we get that to trickle down to our local politicians when, again, topical, we're told we need to do our exercise to have our bicycle lanes? How do we get that message through so we can have our Collins Street bicycle lane? 3 blocks.
Martin, I heard trickle down, which sounds very much like an economic thing. So do you want to, or anyone else, really?
Well, look, so my observation, having been a public servant in different places, actually, our politicians, almost without exception, have gone into politics to serve communities, and they want to get out and talk to communities, but there are very powerful interests get in their ears structurally, but also I think we all allow, in this debate, we're doing it in light-hearted form, but it actually shows us we kind of fall back to stereotype positions. We don't like to actually have real debates about some of these issues. Well, what does it mean to put in the infrastructure? Is that going to inconvenience some people? Probably. How do we develop those debates? So we've all, as the community, got to be willing to, have that debate and get in the ear of our politicians because they want us to.
Get into the uncomfortable grey zone out of the easy black and white. Did anyone want to add anything to that, or should we get straight to the vote results and gift giving? Yeah, I know that was a loaded question. All right. I'm sorry we don't have time, but it was totally rhetorical. Thank you very much. Very much. Okay, I think we're ready. Drum roll. Oh my God. Are you kidding? Wow. Wow. Okay. Oh, well, this is unheard of to the extent potentially rigged. Is that? No. Okay. I mean, is there an actual back engine or did you just have these graphics pre-made? Yeah. Okay. Wow. Well, I guess we got an indication of that from that extraordinary number of people who voted with their hands earlier. But, well, what can I say? The people have spoken. They have been, regardless of the exceptional arguments put forward by the perceived heirs of the winning throne, judging by the initial vote, they have been swayed by the argument for the individual. Your health, your heart, your health is your business, not anyone else's. I know, let's give it up for the negative team. And let's give it up for the affirmative team as well. Woo. Thank you so much for being such eager participants and engaged participants in this fantastic process. Tracy, did you want to say a few closing words? How about I put a microphone in there then?
Thank you. Well, I think this result shows that everybody at Menzies is a winner. So that is a beautiful message to end on. So thank you to our wonderful speakers, Verity, Shauna and Martin. We have a gift for you, but particularly thanks to our colleagues from the broader health service, Tom, Michelle and Andrew, for giving up your time to be here tonight at Menzies. So thanks very much. Thank you, Bernie. It's been wonderful to have you back here with us, and we will want you back again now that we're on a roll. I'd also like to extend our thanks to Anthony for our beautiful music earlier this evening, and to our wonderful helpers on the bar, Imi, Layla and Gaia. I'd like to pass on my absolute thanks to members of our Menzies team of staff and the advancement team who have helped pull tonight together, particularly Pat, who is our wonderful community engagement officer at Menzies. Pat is an absolute superstar, and she has balanced organising tonight with also organising a surprise 60th for her husband, as well as buying a new house in the last couple of weeks. And she's done that with a smile and amazing enthusiasm. So thank you, Pat. So to everyone here who's new to Menzies, please jump on our website and look for ways that you can be involved and stay in touch with us. And finally, to our long-term donors, volunteers, supporters, and everyone that's here tonight, thank you again for what you do. We can't do the work we do without you, and we're very, very grateful. So thanks so much for coming tonight. Safe travels home, and we hope to see you again next year.